Thank you, Cahir. Look, I have a series of questions, so I am going to be brief because I want to hear the answers. First, it's in relation to, I had a question submitted around the number of legal cases against the HSE regarding misdiagnosis. How many were currently in process, and how much compensation has been paid out in the last 10 years. Now, I haven't been furnished with those answers, and I'll await them from the State Claims Agency. But I find it quite mind-boggling that information isn't to hand. Not to me, but to the Minister. And I suppose my question around that would be to you, Minister, in terms of, do you not get regular reports in terms of the numbers of misdiagnosis and the clinical incidents? Because this would all feed into maybe the unqualified consultants, and do you see dangers around that and that escalating? And I know there was, I think it was 34 cases of clinical incidents, 575 cases resulted in claims against the HSE. Again, most of the incidents like that where there's misdiagnosis, people won't bother taking cases. But I just want to ask you in terms of the reports to yourself, and if you're going to change anything around that after the situation with Vicky Phelan. I want to ask you in terms of spinal surgery and the waiting lists there, and what plans you have in place to address that. I know people who are waiting several years for spinal surgery. Now, I want to ask you another specific question. Can these patients go abroad? If they're going to be told it's going to be 3 years before you're going to get your spinal surgery, can we facilitate and pay for them to go abroad to have that if they identify a surgeon somewhere else? I want to ask you in terms of Translarna. I don't accept the answer that I've been given around that, and the reason I don't accept it is because, again, it cites about the European situation, but we do know that it can be conditionally approved, and it has been across most of the EU countries, and this doesn't stop countries from facilitating the provision of this treatment. And why aren't we doing the same thing here? In relation to the price, you'll know the 300,000 per patient that's quoted. That's a public price. That's not a negotiated price. And that really concerns me, because that is untrue. Would it not be the duty of the HSE to negotiate the price on that? And I want to ask you around the timeline. If the drug company submits more information or new information on that, what is the timeline there that we can expect before approval is done? I need to ask you about Versatis again, and I thank you for the answer that you've given, but this would mean that there's still about 23,000 patients who are on Versatis. I take what you're saying in terms of the overprescribing, but I would ask you specifically, I suppose, are you monitoring how many extra patients are using morphine patches as a result of the withdrawal of Versatis? And when are you going to conduct the first review into that, like a post-decision analysis on it? And are you going to meet with the people who are going to gather outside here who are in chronic pain on the 30th of May to tell you the impact that awful decision has had on them? I want to ask Minister McGrath, when can we expect? Finish up. When can we expect the transition to personal budgets for people with disabilities? When will people be in the decision for that? I have numerous other questions. I would say overall that the answers that I'm getting from the HSE in reply to the questions that are submitted are not at all satisfactory. I have another one in relation to GPs charging for blood samples, and that is a continuing practice around when is that going to be addressed? Is it going to be addressed within the GP contract? Because it's absolutely wrong that continues to be done, particularly for people on extremely low incomes.
Thank you, Senator. Minister.
I'll try to go through them very quickly, and we can come back on further detail. Pardon me? Exactly, yeah. So, just to start where you ended, Senator, yes, that will be addressed as part of the GP contract. There needs to be a consistent approach brought to this, and it needs to be fixed. In relation to the issue of legal cases, reporting to ministers, the State Claims Agency, reporting into departments, I mean, I think there's going to have to be significant learning as a result of the scoping inquiry. At the moment, as you've heard from the State Claims Agency, as you've heard from my own department, the HSE, but also you'd hear from other departments, there isn't a reporting mechanism. The State Claims Agency is an arm of the NTMA, sits under the Department of Finance. So I do expect that recommendations will come from that, and we need to act on. In relation to spinal surgery, I don't have the figures here, but I might ask Angela to comment if she has any data to say. But yes, we are investing a lot in the NTPF, but people can go abroad through the Treatment Abroad scheme once it's recommended by their consultant and it's an appropriate recognised treatment here. But I might ask Angela to come back on that. Angela, in fact, you might do that now, Angela, if you know it.
But I can give it to you. But I certainly know that there are 2 or 3 measures that we've taken in the last 12 months with specific reference to spinal surgery. Over 100 patients went in the last quarter of last year were treated from Tala under the NTPF using an outsourced arrangement. In addition, obviously the arrangements with scoliosis have also made provision for the transfer of services from Tala to the Mater, which allows for freeing up of services in Tala, but also allows for adolescents and adults with deformative surgery to be treated in the Mater, and that service has worked very well. And I think our objective working with the NTPF this year is to target a further 100 to 150 patients to be treated with spinal surgery. But we can provide the most recent update in terms of where the particular challenges are and where we expect to be over the coming months.
Thank you, Ms. Fitzgerald. Mr. Sullivan. Minister.
Just on the task force, or the personalised budgets. First of all, can I just say, as you know, the task force for personalised budget was in the programme for government. They did amazing work over the last 12 months under the chairmanship of Christy Lynch and a lot of disabled people themselves, and also a number of disability advocates. You know yourself, it's about controlling and accessing health and social services, and again reflecting the UN Convention of respecting the person with disability and giving them more power and autonomy to make decisions. So the good news is they've finalised the report. I've had it on my desk for the last 2 weeks. I'm finishing it now, and I'm hoping to bring a memo to government. And when I say soon, I'm talking about in the next week or 2. So it has focused. The task force has focused its person on adult services and HSE funded services. But the whole idea again is to give control to the person with the disability and deal with the issue, and I think people will be very happy with the start. It's a start, but we have a long way to go as well.
Thank you very much, Minister. And Mr. Sullivan.
Thanks. I note your comments in relation to some of the responses. Perhaps if you could follow those up with us, if there's something where we need to give more clarification, I'm happy to do that for you. Just briefly then, in relation to Versatis, I mentioned that in my opening remarks. And not to go over all of that again, given time, but we were in a place that particular intervention was being very heavily used in Ireland, used at a level comparable with Britain, which is 10 times the population of here. So we did need to, and it's appropriate that we do in the context of very scarce resources within health and social care, and every euro that we're spending.
So your post-decision analysis, just your post-decision analysis,
well,
I think is important.
Well, at this stage, the arrangement was only introduced in September of last year, so we moved from a place where a very large number of people were receiving this intervention inappropriately to a place now where we have cut from an annual spend of 36 million euro down to 4.5 million euro, so significantly targeting available resources on those individuals who are truly going to benefit from this, and ensuring that other individuals have access to other appropriate interventions that are relevant to their needs. And we will continue to monitor that as arrangements go forward. There's no plans at the moment for a formal evaluation as such, but I can certainly follow up with colleagues to seek additional assurance around all of that. Translarna is an interesting one. Translarna was across my desk in the north as well. A very, very expensive drug, was assessed for cost effectiveness within Ireland. A conclusion was reached that it was not cost effective in terms of the benefit that it offered patients.
Did you negotiate the price?
Did I negotiate the price?
Did the HSE negotiate the price?
The HSE is involved in price negotiations on all of the drugs. That's part of the arrangement. Cost effectiveness is a combination of those two dimensions. So there's two ways a drug can be cost effective or become more cost effective. Either more evidence will emerge as to the impact it's having on patient outcomes, and or the pharmaceutical company can reduce the price. We have left both of those options open to the relevant pharmaceutical company in this case, that if additional evidence can be brought forward about effectiveness and or a lower cost per patient, and that we would look at this again.
Senator, I'm going to have to move on, Sarah.